A South African man is being tested for Ebola in Durban after returning from working in Sierra Leone. The National Institute for Communicable Diseases says they're running the test to dispel the patient's fears. Health officials say the man became anxious upon his return and was referred to Addington Hospital in Durban. Let's get more on the story now. I'm joined on the line by Professor Lucille Bloomberg. She's the Deputy Director of the National Institute of Communicable Diseases. Professor Bloomberg, thank you very much for your time this morning. What is the latest on this patient?
The patient is stable. He was admitted. I think it's a better way of assessing patients properly. We would not regard him as an Ebola suspect. However, we chose to test. I think there was a level of anxiety on the part of the patient, health staff, and intense media interest. And I think that's the best way to go. But we would not regard him as an Ebola risk. He did not have direct contact with Ebola patients or any of their excretions or secretions.
Professor Bloomberg, we understand that he came in, like we say, you're testing him to allay his own fears. What sort of symptoms did he have? Why did he actually come into the hospital wanting to be checked out?
He did return from Sierra Leone, where obviously there's a large outbreak. He mentioned that there were a number of people in the company or close to the company who had Ebola, but he did not have direct contact with him. And he had really very non-specific symptoms. He complained of a sore throat, a rash, and some cramps. But those can be due to many other things. And, I think really the risk of Ebola is in health workers who are working directly with patients in that setting. There are many people who are working in retail or mining or security who are simply not going to have that contact with Ebola patients that would pose a risk. Malaria would be their problem.
How long ago did he return from Sierra Leone?
He returned on the 16th, so it was within the 21-day period of the incubation period. But I think the absence of this direct contact really excluded an Ebola problem.
Is he in isolation at the hospital?
So they have put him in isolation. I think it's the right thing to do. I think it also tests the systems, and I think testing was to go the way of testing was perhaps the right thing to do in the circumstances of intense anxiety and media interest, and to really put some closure on this incident.
How much longer do you plan on keeping him at the hospital, Professor?
I think once the Ebola test is confirmed as negative, and we would expect the results in 24 hours, I think he would be taken out of isolation, and other tests would need to be done. There are many other causes of infections in people traveling in Africa. Malaria would be an important one, and there are others that are common.
Can you give us some idea as to when you're expecting those results for the Ebola testing?
I think within the next 24 hours, we should have the results.
All right, thank you very much. We'll try and catch up with you then. Professor Lucille Bloomberg, she's from the National Institute of Communicable Diseases.